my second clinical rotation, charting, seeing patients.
And then the math really comes in.
Because I was just at work for 9.25 hours. Here's the 2-2 formulas. Here's this. The new charting system that I'm on is a million times easier. I do want to do clinical dietetics as a career. Hello guys, I am so excited to be making this video because right now I can see the finish line. The finish line is in sight. This week I started my second clinical rotation and my last ever dietetic internship rotation. Yes, that is right. If y'all don't know me, my name is Victoria. I go to the University of Alabama and I am in their coordinated program in dietetics, which means that for the past 2 years, while I was a senior in college and then this year my master's year, they have been coordinating my master's classes in nutrition with my dietetic internships so that this May or June, whenever I am eligible to take the registered dietitian exam, I will be able to become a registered dietitian. If I pass, but that's a whole other subject. But I am so pumped because this round of clinicals is already just feeling so much more relaxed, so much easier, and so much less stressful than last semester. If y'all remember, last semester I made my first week of clinicals video and then I basically dropped off the face of the planet. I think y'all saw me 2 months later with a breakdown video because I just had an overwhelming amount of assignments. There was a lot of things going on in my life and I just basically that semester kind of kicked my butt. And it kind of seemed the same with all of my peers in my class, so that made me feel at least a little bit better. We were all kind of on the struggle bus together, and apparently that's just how Clinical 1 goes, and that's just how the first semester of your master's program usually is with this. So this semester, we were talking to some of the girls that graduated above us, and they were assuring us, they were like, this last semester is going to be so much easier for you guys. It's going to be so much more fun and just joy-filled, and so far that has absolutely lived up to everything that I've been hoping for because guys, last clinical, I really enjoyed it. I enjoyed actually being in the hospital. I enjoyed having that 9 to 5 or 8 to 4 or sometimes even 6 to 2 days where I was just working all day, basically being an extra dietitian for their staff, learning everything, charting, seeing patients. I absolutely loved my first clinical. The only problem was all the assignments and all the homework that was piled on top of me. And last semester, if y'all will remember, I had to drive a whole hour to my rotations, whereas this semester I get to stay basically where I am and I do not have a far way to drive. So everything just is coming up roses and everything is so much better this semester, which means that for you guys are actually going to be getting some content from me and I'm not going to get overwhelmed. Cross our fingers, hopefully, and I can actually bring to y'all some more details about what it is like to be in a clinical dietetic internship if you are interested in this route, whether you are already a nutrition major thinking about joining a coordinated program or a DPD, whether you are maybe at the end of your degree and you're deciding whether you want to become a dietitian, or if you haven't even picked your major and you're just interested in seeing what kind of career path this could lead to and kind of how being a dietitian in a healthcare field works. So today is Friday. I already went to rotations on Tuesday and Thursday yesterday. So this will be the third day of this clinical internship and basically rounding out the end of my first week in clinical 2. So I've had a couple days to kind of acclimate, meet everybody there and kind of get used to what their facility is doing and what it is like. And so I wanted to wait until today to kind of show y'all what a day looks like because now I feel confident that I can kind of show you guys what's different between this clinical versus clinical 1, how the two hospitals differ, what is the same, and kind of what it's like transitioning from one hospital to another hospital and learning kind of new rules, new guidelines, and different things like that. So we're going to jump into it. We're going to go see a day in my life as a clinical dietetic intern at this new hospital in clinical 2. And then when I get off today, I'm going to basically go through with you guys kind of how this clinical 2 has been different than clinical 1, kind of what they expect from me being a clinical 2 student, and what I feel like is different between these two different internships and basically these two different hospitals and how I'm kind of dealing with that. So yes, I'm going to grab my lunch, we're going to grab my water bottle and my bag, and we are going to head to the hospital, and I'll see y'all when I get off. Also, sidebar, this video might overlap a little bit with my half marathon prep video because that is right, tomorrow is Saturday and tomorrow I am running my half marathon. And so this afternoon I have to go pick up my packet for like running the race and basically do a bunch of other things. I have no idea what time I'm going to get off this week, but we're going to see. This whole week I've been working about 9 hours instead of 8 hours. So we're just going to see how it goes and what it's like, but that may overlap a little bit depending on what time I get off.
At the beginning of every workday, the head dietitian will start by printing out lists of the patients that need to be seen today. So this could either be patients who have consults from doctors for us to see them, or it could be people who screen as needing to be assessed for something like malnutrition or people with pressure injuries, basically anything that have nutritional concerns. So she starts by printing out those lists and then she distributes those patients evenly among all the dietitians, either based on what floors they are and what floors each dietitian has, or just based on the numbers if it's a floor that people split, which I'll talk about later. Because my dietitian for this week worked in one of the ICUs. So we had everybody in that ICU. It was about 16 beds, but then she also split one of the other regular floors, which we did in the second half of the day. So in the beginning half of the day, we started with those patients in the ICU. So every day we come in and basically we go through the charting system and we go through each patient, and we each have like a little sheet of paper where we keep track of the patient's information that is pertinent to us specifically. So basically we'll go through their chart. Let's say we have patient A is in the first bed of the ICU, so we'll start with them. And we go to patient A's chart and we look through and we first look at the provider notes. So we look at basically, did anything happen overnight? Is there any dramatic change that we need to note? Or this would be the time where if you have a new patient in this ICU, then you go through it and you read their history and physical, see what their pertinent diagnoses are, and write those down so that you can know them. Then after that, we go and look at their labs to see what their lab values are today, and we'll write those down, like the ones that are out of range. And then we'll go and write down their pertinent medications. So this is either going to be like pressors, which can impact whether you're going to give them tube feedings on like a drip or at full volume. Or we're also going to write down like if they're on a bowel regimen and anything that's going to make them have maybe like some diarrhea or something like that. And basically any medications that are pertinent to us, any like vitamins, minerals, anything like that, or anything that provides calories. So for example, if a patient is on a ventilator, they are probably also going to be on a sedative. And so one sedative is called propofol, and that actually provides calories. So all these types of medications we will write down on this little sheet. We'll also write down things like when the patient's last bowel movement was, and also what diet that they are on, whether it's an actual diet that they're eating food or if it's a tube feed like order, and then also supplements that go along with that. So for example, like if they have protein modulars, or like, and that would be like Liquicell, or if they also have like push, which would be if they have a pressure wound, and that's like collagen. So all the things like that we are going to write down on this little sheet. And why are we writing all of this stuff down, you ask, if it's just already going to be in the chart for us to look at? Well, it's so that we have this information for rounds, because yes, in the ICUs and sometimes on other floors, but usually just the ICUs, there are going to be multidisciplinary rounds where basically at a certain time in the morning, all the disciplines for that floor of the ICU will meet together. So this week, my preceptor met at 9 a.m. So we really didn't have all that much time to be like looking up information. We had to do it within an hour because we got to work at 8 a.m. So basically, we have to look up all this information by 9. And at 9, we meet everybody on the floor. And everybody is going to include the doctor for that day. It's going to include the pharmacist, the physical therapist, the case manager, and also like the respiratory therapist and the nurses. And the nurses is who we get our main information from, and they will tell us, of course, if anything happened overnight. They'll tell us any notes that they have from the people on the last shift and basically give us an update. Or if it's a new patient, they'll basically give us the whole rundown of what they're doing here, how they got here, and everything about them, their family, anything that we might need to know. And some days if we do have a little bit more time, or if I'm extra fast with finishing looking up anybody that I need to from the ICU, I will also have time to go ahead and look up people that we're going to see later in the day on the other floors. So I mentioned that sometimes they split the regular floors. And so this was one of those days when they were splitting it. So my preceptor gave me a few patients specifically. On the ICU, I look up everybody, and then we kind of decide after we go on the floor and after we go on rounds, which patients or how many patients I'm going to chart on and assess. But for the regular floors, my preceptor will go ahead and look at who we have and then give me certain people. So I will be able to go and look up all the information about them. Basically the same things, but usually people on the regular floors are not going to be ventilated. They're not going to be going through as much. And for them, I'm going to be writing down questions that I want to ask the family in the room so I can go ahead and think about that, because more than likely the patient will actually be awake, whereas in the ICU, usually you're talking mainly to the family or to the nurses. So I just want to get everything down, and that will make my day easier later. So after we finish collecting the information on our people, we head up to rounds. And like I said, that's when all the other multidisciplines are there. And basically we go room to room, we stand outside the room, and usually it depends on the floor and it depends on how serious the case is or whether the family is around. But a lot of times the family members, or at least one family member, will actually come out and be a part of rounds. And so they will give us any information that we need about the patient's history or anything like that. And the nurse for each specific room will tell us basically, like I said, the updates from last night, anything we don't know. And it's basically time for everybody to ask questions and make sure that the entire team is on the same page with the care for the patient and with the care going forward for making sure this patient can get back maybe out of the ICU and onto a regular floor or anything like that as soon as possible. So we go around to each of the different rooms on the ICU floor, and that usually takes us about 45 minutes, but it kind of depends on which floor it is and how fast different people are going. And a lot of times it depends on the doctor as well, because some doctors are a lot quicker than others, while some have a lot more questions and want to take a lot longer of a time. Then when we're done with rounds, but we're still on the floor, that is when we go around and we actually see the patients that we need to see. And sometimes, like I said, if the family is not present or there aren't any big updates, sometimes all we'll do is go into the room and look at the patient's tube feed and see what it's running at, if it's at goal rate or not. But other times, if it's a new patient, we might go in, we might talk to the family and ask them some questions, or the patient if they are awake. And usually the questions that we ask when we go in are firstly about their appetite and how they were eating prior to admission, as well as since being in the hospital, so that we can see maybe if they haven't eaten in a few days, and things like that. The other questions that we ask is about if they have any trouble like swallowing or chewing, just to make sure that we don't have to refer them to the speech language pathologist. We also ask them about their weight loss recently, and if they've had any weight loss in the past year and how much that is, and basically talk through that with them. Because these are all criteria for malnourishment, which we have to know, and which is really, really prevalent in the hospital. We also ask them about what a usual body weight is for them, and then we kind of compare that to if we have any prior information in the electronic medical record from their past stays. And then we also ask if they've taken any oral nutrition supplements at home, like Ensure or Boost, and see if they would like to try any while they're here in the hospital. And these are all just examples of questions that we ask either the patient or the family while we're in the room. The other thing that I do when I'm in the room and when I'm seeing a patient for the first time is I will perform a nutrition-focused physical exam. And this is basically, I'll put on some gloves and I'll go through and see about some of their different muscle and fat groups. And this is an example of a book that shows us examples of mild, moderate, and severe wasting of these different types of muscles that kind of gives you a visual. But I've done enough at this point where I don't need to look at the book to know when something is mild versus moderate or moderate versus severe. And so I'll go through all these different parts, and sometimes this does depend on how much of the patient is really readily available. I really don't usually do anything that is I basically just go for their face, and I do the temples, the buccals, the orbital fat pads under there, and then I'll also do their clavicle because that's usually easy under their gown, and then I'll do their tricep, but sometimes it's painful for them to do their arm if they have some IVs in, and then also sometimes depending, I'll do their gastrocnemius muscle, which is under the leg, but you have to hold your leg up for that a little bit. So sometimes depending on what state the patient is, I really only get their face and clavicle and their upper extremities, but sometimes that's useful because a lot of times patients have edema, which is fluid buildup in their lower extremities anyways, so it's hard to tell any muscle and fat loss. And then after we're done seeing all the patients that we have to see on the ICU, that is when we go back downstairs to the office to start charting on those patients. So we open back up the electronic medical record, which is where we got our information from in the first place, and then we make our own nutrition note, either a nutrition assessment if it's a new patient or a nutrition follow-up if it's a patient we're seeing again. And in this we put everything about what we actually saw the patient about, all the information that we got from the patient versus what we got from the nurses versus what we got from the electronic medical record, and we write all of it down. We also make nutrition diagnoses, and so this is a big part of being a dietitian, is making diagnoses. And like I said, one of the most common is malnutrition, and so this is a little booklet that has all of the criteria for malnutrition. And so we basically go through this and kind of see what we thought about the patients that we saw and whether they meet the criteria based on both their weight loss, their muscle loss, fat loss, and also like how long they've eaten and all of that type of thing. And then the math really comes in, because next you have to estimate everybody's energy needs. So even if somebody is on a tube feed or if they're not on a tube feed, you have to calculate what their calorie and protein intake really should be for everything that's going on with them medically, because obviously a lot of medical things can increase your calorie and protein needs. And so basically we have to do a lot of math that's specific to like their needs, specific to their height, their weight, their age, and do all these different calculations. And yes, the tube feed ones are a little bit more complicated, and this is just a notebook full of just all of my random notes that are put in here, all the random numbers. And yeah, it's just helpful to have a little notebook to just scribble on. Obviously I have done a lot of math over the last few weeks. And then after adding everything into our charting system, we basically finish that up and then write how long we want to wait until we follow up on this patient the next time. And then usually after that, it is finally time for lunch. At this point of the day, I'm super hungry and basically needing to have snacks. So lunch is always a good reprieve. And sometimes during lunch, I do work, but I don't always. Sometimes I just enjoy my lunch, or sometimes there's not anything that I could be doing during lunch. So today was one of those days where I just watched my lunch and enjoyed it. And then after lunch was over, and because I had already gathered information on my people that I had on the floor, I went back up, I saw those patients, assessed them, followed up on them, and asked them the same questions. And then it was time to go back down to the office to chart on those patients. And this honestly takes about the same time as the morning. It's about the same things that you do in the morning. Just in the morning I was doing ICU patients, and now I'm doing kind of the more regular floor patients. And also the afternoon time is time for me to do some of my assignments. So these could be things like that my preceptor actually has to watch and evaluate me on, and then also some things by myself, like for example finding a patient who needs tube feeding recommendations and then basically writing like a short little paper about 2 different ones that they could use and why you would choose one over the other, or also doing something like a nutrition focused physical exam that your preceptor actually has to watch and like basically grade you on how well you do. And then another thing that's an example of what my preceptor has to watch me do is a diet education. And now I did not do a diet education today myself, but at the end of the day, the very last thing that we did today is that we got consulted for a diabetes diet education for somebody who was newly diagnosed with diabetes. And because one of my diet educations has to be on diabetes, I went up and wanted to go watch my preceptor do this one so that when we got another consult for another diabetes education, I would be able to do that one by myself. And what's interesting is that the diabetes educators had already seen this person today, but we were more talking about like the kinds of foods that they would eat and the different diet that they would be on. So it was really interesting, and I'm really interested to see how that will play out when I do my own diabetes diet education. But today made me feel a little bit more confident, and I'm really glad that I watched. And overall, I just feel like it was a really great day, had a great time, and yeah. Okay guys, I just got done with clinical for the day, which means that it's the night before the race. I am feeling like jittery because I was just at work for 9.25 hours, except don't call it work because I don't get paid to do my internship. I'm paying to be there, and I'm kind of freaking out because I have to go to the store and I need to get some pasta sauce and some turkey for the big bowl of spaghetti that I want to have tonight. And also, I need to go get my packet pickup, and I need to go get like my race bib and all of my things. So I'm like, it has to happen like ASAP. So basically right now, my friend just went to go pick up her packet, and she told me, oh, get out of the road. I'm not actually freaked out driving right now. I just sound like it, but it's outwardly like we're good. It's just inwardly kind of panicking. But my friend said I should go pick up my packet first, but the packet pickup is near my apartment, and so I kind of want to just like go to the grocery store on the way home. Also, I'm seeing all of these darties set up like for day parties, like on Saturdays at the frats. They all have their tarps up, and I'm like, I am so excited for the weekend. Y'all can probably hear the band practicing right now. Yeah, you totally freaking can. Oh my gosh. I'm literally just like, this weekend is going to be so fun. I'm so pumped for it. And it's happening right now because I just got off a rotation. Ah! But anyways, we have to go get our packet. Oh, everybody's like out and about and walking around and having time of their lives. And there's a girl that I know from home. That's... what the hey?
should have rolled down my window and screamed. Gosh, I look crazy in my scrubs right now. I'm about to look crazy in my scrubs running across the park to go pick up my thing. Everybody looks so cute outside. Everybody's having a great time. All the tarps are up for the darties. Everybody's in dresses. It's a Friday night, except I can't go out tonight because of course we have a race tomorrow morning, which is sad. Okay. It's 5:18. It's 5:18. Packet pickup stops at 6. Am I gonna make it? Am I gonna make it? I can get it tomorrow morning, but I don't want to get it tomorrow morning. I want to get it tonight. Am I gonna make it? I don't know. And the quad looks beautiful outside. I know I'm just rambling right now, but I literally am like, this is one of those times, I've been having a lot of times recently, where I am just so incredibly happy to be alive. Everybody's getting their grad pictures taken. I just scheduled my grad pictures. Like, this is just like, everybody looks cute. Everybody looks fun. Everybody looks excited to be alive. I'm excited to be alive. It's a Friday night! Okay, I have to actually stop now. Well, I don't have to stop. I don't have to calm down because I'm happy and I should be happy. So, I'm gonna keep being excited, but I'm gonna hang up on you guys, hang up the phone now, and I will see y'all when I go get my stuff from the store and then we run to the park to get my packet pickup. Okay, bye. I think pack pickup is over there. And I'm epically rocking my scrubs right now. Okay, let's talk about this week and this clinical. So as you can see, I did again work more than 8 hours today. Today it was not only 9 hours, it was 9.25, but my preceptor said that I could take basically, like, I could get off early one day next week, which is exciting because next week I'm actually gonna be working 4 days in a row, 4 clinical days in a row, because the next week I'm trying to get Friday off, so I switched. So usually the most that I do is 2 days in a row. So 4 days in a row is kind of going to be like seeing what the real deal is like what it's like to have a job in clinical, which is a little bit nerve-wracking, but it's going to be worth it in the long run. But I may get to get off early one of those days because of how late I stayed today. And like I said, today I stayed late because we had a diabetic diet education. And one thing that is different about the hospital where that I am now is that they actually have an entire diabetes center that's connected to the hospital that people can go to, both outpatient and they also see people inpatient. And so what was interesting to me, because my last hospital did not have that, and what was interesting to me is that when my preceptor told me that the diabetic educators had already seen the patient we were going to see, I was like, oh, perfect, we don't have to see them. But essentially, the diabetic educators talk to the patients about like their insulin regimen, whereas like we, the dietitians that work at the hospital, talk to them more about what like a balanced plate look like and what their actual diet kind of looks like going forward with the condition that they have. And I will say it was good for me to stay and to see that, because one of the assignments that I have for this clinical is to do a diet education. And last semester in my first clinical, I was supposed to do a diabetes education specifically, but there actually ended up being no patients at our hospital that had diabetes, that it ended up being a good time or a good patient for me to see. So I have to do that now in this clinical rotation. So today I kind of got to see what that's like so that in the future I can do one by myself when one comes up again. And I am still not quite sure that I'm feeling confident in that, but she printed out like a packet that had all the information and just went through the packet with the patient. So that makes me feel a little more confident. Like if I have a guide that is kind of reminding me what to say and what to do, then I think that I'll be totally fine, but we will see what will happen or when that will come about. Okay, so first I want to talk about the difference between this clinical and the last clinical. And it's very interesting to me because obviously every hospital is going to be different. And the one thing about like dietitians working in a hospital, usually like the nurses stations are on every floor, or different like offices are on different floors. The dietitian's office from the 2 hospitals I've been at is usually on the bottom floor and it has no windows. It's like on the internal part of the hospital. And usually it's just one room that everybody's in, maybe an extra room for like the head dietitian or the clinical manager dietitian. But what's interesting, my last hospital, we didn't have cubicles. My last hospital, we all sat at like a continuous desk that was like around the border of the room, which was a lot easier to talk to each other. All day we were talking, we were like, people would be in their swivel chairs and they would and they would be like, hey, what do you think about like giving this to like a patient with this disease, or like, you know, what do you think about this? So it was really helpful for like collaboration, whereas this one, we have cubicles. And so dietitians at this hospital don't talk to each other as much during the day. And I also feel a little bit more apprehensive about going to ask my preceptor a question, because I feel like she's kind of like closed off, you know, even though she's not really. But it's definitely an interesting dynamic difference, and I guess both personalities and also just like the setting of the office. So I have my own cubicle as a student, which I'm the only student there right now. Sometimes they have students from different universities, so I'm kind of glad that I'm the only one, because it's making it a little bit easier. But also, this hospital that I'm at right now has a lot more of the information that you need on hand easily. Like, it's already posted up on the sides of my cubicle, so I can just look and be like, oh, here's the tube feed formulas, here's this. All those papers that I showed y'all in my like clinical prep video when I just reset for this clinical like this Monday, I had all these papers and I don't even need them because they're already posted up. My last hospital didn't really have that as much, and they didn't really have as many resources for me as a student. This hospital gave me a whole student handbook that's like this little like thin book, and it has all the information and all of their policies and procedures. And that one paper that I showed y'all from my last hospital that had all the different like diseases and the range of calories and protein and stuff that they recommend for those, this hospital uses the exact same guide. So I felt super good about that. I was like, perfect, I've already practiced with this, I already know this. So that information was like the exact same. I don't know if it's because maybe the same person owns those hospitals, or maybe it's like some kind of information that's just like all clinical dietitians have. All I know is that they had the exact same information for that. And so that's really helpful when I'm like looking at a person with cancer, for example. I'm like, okay, perfect. At my last hospital, this is the guidelines we use, and then this is the same at this hospital. The other difference between that hospital and this hospital, and also the reason that I want to talk about the differences, is just because I think I would have wished to hear about some of this from somebody else, just because, again, different hospitals are different, and I don't know what the day of a clinical dietitian looks like. So at my last hospital, everybody would arrive at different times and leave at different times of the day. There was somebody that got there at 6 a.m. There's somebody that got there at 7, at 8, at 9. And that was like, everybody was interspersed between those times, and everybody left at different times. At my new hospital, y'all, everybody gets there at 8 o'clock on the dot, and they leave at 4:30 on the dot. So it's like an 8.5 hour day. Everybody but my preceptor. And I'm not sure if that's because I am like a new student, and so she like feels like she needs to take more time to teach me, or just because she is like the head dietitian, so she probably has a little bit more duties to do even after I leave for the day. But we have been staying more around like, maybe it's like an 8 to 4:45, 8 to 5, or even like today it was like an 8 to 5:15. Also, my first hospital, they all very much just ate lunch at their desk while they were working. It was a working lunch. You just sat there with whatever you had. Nobody ate in the cafeteria. Nobody left for lunch. My new hospital, they basically are like, okay, you should just go to the cafeteria to eat. Like, just go take this break. Like, and basically I will still work during that time and like do some of my assignments, because I don't want to have to do them when I get home. So it is kind of still a working lunch for me. But it is interesting because this hospital has like a whole cafeteria and even an outdoor space to eat, which I think my other hospital had, maybe just on a smaller scale. But it's interesting the work habits of people and kind of how everybody does the same types of things. Although there are some people that stay in the office to work, and I think that's also a reason why a lot of them get to leave at 4:30, is because they worked through lunch, and so they don't have to spend that extra 30 minutes staying at the hospital. Now, on the topic of what the day-to-day looks like, that is pretty much the same between both hospitals. At both hospitals, we start the day with looking at patients, then we go on rounds, then we see patients, and then we chart on patients. Now, this new hospital that I'm at, it's a little bit different based on the schedules, like, or what my preceptor has from day to day. And so like today, or like actually yesterday, Thursday, it was like we really quickly looked up some patients, and then she has rounds at 9 in the ICU, and so we had to go up really quickly, like just an hour after we got there. And then we went on rounds, and then we went around and saw the patients there. But then we come back downstairs, and then we look up more patients, because they also share different floors at this hospital. And so she had to look up different patients and then go up to see them and then come back down to chart. And there was like one day where it was like 12:30 and we had not had lunch yet. And we also had not gone up to the floor to see patients yet. And I was like, oh wow, I'm gonna be hungry. Like I started just like eating snacks in preparation because I knew we were about to have a late lunch and probably a late day. But overall, the schedule throughout the day is the same at both hospitals that I've been at. And so that kind of seems like kind of down the line what you do as a clinical dietitian. What's also interesting is rounds at the different hospitals. So at my last hospital, pharmacists did not come on rounds, but at this hospital, they do. And at this hospital, rounds are a lot more formal and a lot more scheduled. At my last hospital, sometimes you would go up at the time of rounds, and if nobody else was there, then it was like, okay, nobody else showed up, rounds are off today, we're not doing it. And also the importance at different hospitals of different people. Like at my first hospital, the case manager was really important. She always had like her own computer that she was like pushing around with her, and she was like the head honcho of the deal. At this hospital, the case manager barely says anything a lot of the time. And so I think it's just interesting of like what different patients need on different floors and who you're working with. Also, speaking of different floors and kind of how you split that up, one thing that is interesting is that at my last hospital, every dietitian was assigned to their own 1 to 2 floors, sometimes even 3 floors, and that was just their floors pretty much all the time, unless like somebody left for a new job and then you got promoted like up to the next set of floors. But other than that, you pretty much kept your same amount. This new hospital, I am getting there right in the middle of them swapping floors with each other. So somebody who's been in the ICU for the past few weeks is now going to like the med surg floor, and then like vice versa. And so it's kind of swapping around. And this new hospital does not have nearly as many ICUs or patients in the ICU, like beds in the ICU, as my other hospital did. So that is also kind of interesting. And the patients here seem to be a little bit less like in need of a lot of the things that my last hospital was providing. Like this hospital, I think only usually has like 10 parenteral nutrition patients at a time, whereas the other one had a lot more. And it's just kind of interesting, like the difference between the two, but it's also like big hospital versus small hospital. So that's kind of what you get there, which is also a good thing for me to think about when like going to get a job after this is like, do I want to work at a large hospital with a lot of ICUs, or do I want to work at a small hospital where it's a little bit more manageable? Because these new dietitians definitely seem like they have a lot more time to go to the patient's rooms, to have really in-depth conversations with them, and to really chart in depth on them after the fact. And speaking of charting, that is another thing. So charting, there are a lot of different charting systems out there. My last hospital used Cerner. I can now certifiably say Cerner might be like the worst charting system that I've ever used. It was so difficult. There were so many different things. Like you would open the screen and it was just so much information all at once. I feel like I was always lost and just never really knew what to do with it. Whereas this new charting system, we have, I'm trying to think, I don't know, it might be like Meditech or something, but I also know there's like Epic and there's other ones. But then anyways, whatever it is, the new charting system that I'm on is a million times easier and a million times quicker, because this one is more like checking boxes rather than like typing full paragraphs the whole time. So that's also been interesting, because I feel like once I get more into seeing patients, I'm going to be able to do more quicker. Now, let's get on the topic of seeing patients. So this is my second clinical. In our first clinical, my professor's goal for us was to see about 4 patients. Okay. By the end of my first clinical, was seeing about 8 patients a day. And so I was interested how that was going to flow into this one. And also, mind you, last semester, I had my clinicals in one of the first groups. So we have 2 semesters of this year, right? I was at the beginning of the first semester, and then there was a group. And then now I'm at the end of the second semester, so there's another group. So I haven't had clinical for 7 months. Like I was not doing clinical all of these months in between. So I was like, please have mercy on me. I'm not the best with calculations. Once I get into the rhythm, then I'm really good. But starting off, I was like, give me a little bit of grace. But I also was eager to start seeing patients and charting by myself, because this is my second clinical. And as I'm thinking that I want to do clinical as a career and as a job, I really want to just start getting into that and doing that, because I want to be prepared for the job that I'm going into. So the first day of this week, I basically just watched my preceptor. I didn't even log into my account in the charting system. I just watched my preceptor. I followed her. I shadowed her. I was like, basically just watched her. The second day, she had me also write down the same information and look up to the same people as her. But again, she was the one who talked to the patients. She was the one who talked in rounds, and she was the one who like did the actual charting, but I just had gathered the same information as her. Today, I was like, hallelujah, because I got to see in 3 different patients. I got to talk to them, I got to look up their stuff, and I got to chart on them, which was really awesome. And it kind of seemed like my preceptor was not expecting me to be that quick with them, because I would be like, okay, I'm done looking up this person. And she'd be like, oh, well, do you want to look up this person too? Or I'd be like, okay, I'm done charting on this person. And she would be like, oh, well, okay, like I'll check this one, and then do you want to do this next one? And so of course, because she's my preceptor, she checked over my charts, she looked them over completely, but I did get to do 3 different people today. And honestly, with those 3 people, I felt pretty confident. Like, she did not have to change a lot of the things in my charting, she didn't have to change any of my recommendations on calories or proteins or any of my tube feed calculations, which made me really happy because that's what I was the most afraid about. So I was really feeling confident about it. So that's kind of been my entry into clinical 2 and how that's been going from like when I was kind of self-sufficient and at the end of clinical 1 to now. And I also feel like it's kind of a game of like whatever hospital you're at, you're gonna have to relearn things because you're almost training for that specific position, you're training on that specific charting system. And to be honest, when I get a job in clinical, I'm probably going to have to relearn a lot of things and kind of like retrain, if that makes sense, because they might have a different charting system, a different way of doing things, and different guidelines. And also, I am not sure what next week is going to bring, because this week I was with one preceptor, the head dietitian. Next week, I will be with a different one of this hospital's dietitian. So she's just in the other cubicle over for me, and I've already talked to her, met her. She seems super nice. Honestly, everybody there is super nice. I have yet to meet a dietitian at any of the hospitals or places that I've worked with that I don't love. Everybody is just so kind. And so I am excited to like work with somebody else next week, see somebody else's technique, but it's going to be interesting because I don't know how comfortable she feels with letting me do different things, and if she'll want me to shadow her again for another day, or if she'll just go ahead and give me patients. I'm not sure. And I also can't remember which floor she worked on. This week I was on the ICU with my preceptor. I'm not sure which floor she is, and like I said, they're actually switching floors right now, so it may be the ICU again if she's getting that one. I'm just not sure, but it will be interesting to say the least how that will go versus this week, and kind of like what the difference is between precepting styles and stuff like that. But overall, that is what my day-to-day has looked like this week. That's how my day-to-day has compared to my first clinical, and how basically it's gone from me going from clinical 1 to clinical 2, and how I've made that adjustment and how that has gone for me. It's not to say it will go that way for you, and it's been pretty, honestly, it has been a good adjustment for me. Like, I think it's been pretty smooth. And also I know a lot of people just do their clinical at one hospital and they don't do it at separate ones, or they don't have 2 different clinical rotations. So it also just might depend on what your program is like, but so far it's been pretty good for me, and I just kind of am waiting to see what next week holds, how it's gonna go. But overall, I feel like it has been good, and that's what we've been doing from the day to day. That's how my days have been going. And yeah, this is really solidifying to me that like I do want to do clinical dietetics as a career, and I am really excited about the prospect of like applying to hospitals, because I actually feel confident in my abilities and my skills and my capabilities, and I really have enjoyed it thus far. So yeah, I hope that this video was helpful to anyone who is maybe about to start clinicals. Maybe you are about to start clinical 2, or again, you're just interested in nutrition and what it looks like to be a dietitian in the health field. I'm not a dietitian yet, I'm just an intern, but I'm gonna be there soon in just 1 month, which is absolutely crazy. But yeah, I am so excited about it. I'm so excited about life right now. Everything I feel like is just going great, and I feel relaxed. And the other thing that I forgot to mention is my assignments for this clinical. I said it was a little bit more laid back. So on Monday we have 3 assignments due, and I've already been able to do like a good amount of each of them. And so I don't think that will be very difficult to just get those done and turn them in this weekend. And yeah, y'all please let me know in the comments if y'all have any questions specifically for me to answer, or if there's anything that you're just wondering, curious about, anything that you want to see or like have me describe about like different things that a clinical dietitian does in the day. It's definitely in the medical field and in the healthcare field, but it's definitely not very gruesome or gory. I mean, you're not really seeing anything. You might have to look at some pictures of patients' wounds to kind of see, you know, how much nutrition they might need to heal those wounds, and like pressure fracture injuries and things like that. But beyond that, you're really just talking to patients and you're really just charting and doing calculations. And I'm somebody who doesn't really particularly like math. And I'm somebody who also in high school thought that they hated science. And yet here I am. And honestly, I'm having a great time. I'm really enjoying it. And yeah, y'all, please let me know anything that you want to see or know, any questions. And I hope that y'all have a great rest of your semester, a great rest of your month, a great rest of your week, your day, whenever you're watching this. I just hope that you guys are like having a great time. So yeah, I will see y'all in the next one. Peace.